Hi, good afternoon. My name is Maureen. I'm your nurse today. I'm going to perform a head-to-toe assessment. Can I have your name and date of birth, please?
Yes, Nancy Jordan. Date of birth is 11/11/1947.
Very good. I'm going to just go wash my hands. You wash your hands and sing happy birthday twice, normally. Okay. Are you experiencing any pain today?
I am not.
Okay. Could I ask you the year,
The year is 2020.
the season,
It's fall.
and the President of the United States?
Yes, he is President Trump.
Great. I'm going to just assess your scalp right now for any lesions and openings.
Mhm.
Take your glasses off.
Thank you.
Okay. Very good. Very good. No lesions or abrasions. Scalp is clear. Now I'm going to assess your ears, okay?
Mhm.
Just for any redness and drainage. And I'm just going to use, oh, I have to take this off. That's bad. Anyways, okay, can I have you turn your head a little the other way? Okay, down. No redness or drainage in that ear. And we'll check the other ear. Pull back. You can turn your head a little the other way. No redness or drainage. Very good. And now I'm going to assess your eyes. For the sclera is white. Could I have you pull down the conjunctiva is moist and pink. And now I'm going to flash this light in front of your eyes to check your pupils. You just look straight ahead. And your pupils are equal, round, reactive to light, and accommodating. Now I'm going to assess your mouth. Okay? I'm going to have you smile, frown, and puff your cheeks out. Very good. Now I'm going to just assess your lips, and I'll have you open your mouth and stick your tongue out and to the side, please, each side. And there's no breakage in the teeth, and tongue is moist and pink. And now I'm going to assess your shoulders. I'm going to have you push down or push up. Okay. And then I'm going to assess your lymph nodes and your trachea. Can I have you swallow? Everything's good. And now I'm going to do your arms. We're going to test your strength. I'm going to have you push down on my hands. And we're going to press up, turn, and press up. Strength is strong bilaterally. And I'm going to have you squeeze my fingers. Very good. And now I'm going to have you do some range of motion. I'm going to have you turn your wrists. And I'm going to have you bend your arms. And I'm going to have you go up in the air. Very good. Okay, now I'm going to assess your respiratory system. And usually you do this for 1 minute. There's no crackles or rattles. Her lung sounds are clear. I'm going to actually check the back of you now. I'm going to have you take some deep breaths. Lung sounds are clear. Now I'm going to have you lay in the couch so I can check your jugular vein.
Sure.
Okay. I'm going to have you turn your head a little. Check for any JVD, jugular distension, vein distension. Very good. Okay. And now I'm going to assess your heart valves and sounds. I'm going to assess the aortic valve. S1 and S2 are heard, lub-dub. And I'm going to check your pulmonic valve. S1 and S2 are heard. And I'm going to assess your Erb's point, which is at the third intercostal space. Lub-dub is heard. And I'm going to assess your tricuspid valve. S1 and S2 are heard. And your mitral valve. No murmurs present. And now we're going to check your bowel sounds. Actually, we're going to do your capillary refill. I'm going to have you sit up. I'm going to just check your capillary refill on your hands, on your fingers, on each finger. Capillary refill is less than 3. Very good. And there's no clubbing present? Okay. Okay. And now we're going to check your gastro. Listen to your bowel sounds. Have you recently had a bowel movement today?
I have
And any color?
brown.
Okay. Diarrhea recently?
No.
Nausea and vomiting?
No.
Okay. I'm going to inspect your stomach, so I'm going to have you lay down again.
Okay.
You let me know if this is bothering you. I'm just going to palpate it. The stomach is tender, no distension, and it's flat. I'm going to listen to your quadrants. And you usually do that for 30 seconds. And this is the right lower quadrant. We're listening for clicks. And your right upper quadrant. And your left upper quadrant. And your right lower quadrant. Her bowel sounds are active. If they were not active, you would have to assess her bowels for 5 minutes. And when was the last time you voided?
Today?
Okay, was there any odor to your urine?
No.
Color was good?
Good, yes.
Any burning or any sensations when you
No.
go pee? I'm going to actually assess your capillary refill in your toes.
Oh, yes.
Okay. And check for any openings. Very good. And then just check on each toe. Capillary refill looks good. And this, very good. I'm going to have you push your feet against my hands.
Mm-hmm.
Strength is good bilaterally. I'm going to assess your dorsopedialis pulse bilaterally. Pulse is present. I'm going to do the tibia pulse. Pulse is present. I'm going to just check you for any edema on both sides. No edema present. Very good. Okay, very good. And I'm going to have you actually lift one of your legs, range of motion, and do the other. Range of motion is good. And then I'm going to have you stand up. And I'm going to have you just walk forward, or actually walk this way, so I can see your gait. And walk back this way. Her gait is stable. And her skin is intact. There's no lesions or abrasions. And that's that.